February is American Heart Month, and despite the COVID pandemic continuing to remain prevalent, doctors are urging people not to ignore potential signs of heart issues. Heart disease remains the #1 killer of Americans, and any symptoms of a heart condition need to be closely monitored by a doctor. However, Dr. Ilan Yarkoni at UHS Medical Center says they've seen many people who have been reluctant to come into the hospital or doctor's office to be checked out due to fear of contracting the virus. Despite that, Yarkoni says you should still remain in contact with your doctor if you're experiencing any heart issues, as some symptoms of COVID can also match symptoms of potentially deadly heart conditions.
Interestingly, we saw a lot of patients that thought that they were having COVID infection early on, but they in fact were having acute cardiac issues like atrial fibrillation or even heart attack.
Dr. Yarkoni says it's been a challenge over the last year to properly diagnose patients with these symptoms because of how similar they are to one another. However, he adds that with additional testing equipment, the hospital system has been able to more easily determine what the symptoms are stemming from.